Hello, my name's Kelda and I'm a midwife at the Norfolk and Norwich University Hospital, and this is your Midwifery Week webinar. So this is coming as part of the week of virtual activities organised by the Norfolk and Norwich Skills Academy. So the idea of this webinar today is to introduce you to midwifery as a profession and also to take a little look around midwifery at the Norfolk and Norwich, so you get a flavour of the kinds of roles that midwives can do and a bit of a feeling about how to get into it and how it actually feels once you become a midwife. So to do this, I'm going to share some slides with you. So I'll be sharing those now and we will get started with talking about life as a midwife. So I'm just going to hide myself so I'm not distracting, being in the way, and I'll come back again at the end. So, as I said, we're going to cover today a little bit about what a midwife does, places that you can look for other information. So if you're thinking of doing a midwifery application, where you could look to find some more useful information, and talk about opportunities through from newly qualified midwife into Band 6 experienced midwives and more specialist midwifery roles. So what is a midwife? Well, there are lots of different ways that midwives are described around the world. And really, midwifery is a centuries-old occupation to do with attending women at birth. The Old English word midwife means with woman, and traditionally, although this was more of a female role, actually midwives nowadays can be male or female, and it's really open to anybody who is interested in giving women that support during the pregnancy and postnatal period. So what does a midwife do? Well, as I said, the word midwife means with woman. She's a trained professional who assists women during pregnancy, birth and postnatally. And midwives must hold a professional qualification and be registered with the Nursing and Midwifery Council, the NMC. We'll talk more about the NMC later. You sometimes hear midwives referred to as professional friends, and really that's a good way to sum up a midwife, because midwives are in a unique position through pregnancy and birth and build up a relationship of support with women. And one of the joys of midwifery is that relationship that you have with a woman at the pivotal time in her life. You'll hear lots of the midwives that we've spoken to today, and I'm sure some of the case studies that you may have seen during Midwifery Week, where midwives have talked about what a privilege it is to do this job, and that is absolutely true. So, some good places to explore online if you want to find out some more information about midwifery. So the Royal College of Midwives is the professional organisation and trade union which is dedicated to midwifery and midwifery teams. The International Confederation of Midwives is an organisation which strengthens professional associations of midwives across the whole world. The Nursing and Midwifery Council, which I mentioned before, is the main nursing and midwifery regulator. And so it's the NMC that hold the register for nurses and midwives. So when you're a qualified midwife, you have a position on that register, which shows that you are able to practice as a nurse or midwife. And then the National Childbirth Trust, you may have heard of, NCT, is one of the largest parenting charities. And they have an aim really of sharing parenting knowledge, promoting networks between parents, and they campaign to influence policy around parenting as well. So they're all really good places to look at online as a starting point to find out more about midwifery. And it's important as well to know about the existence of this document. So this is the Better Births document, which is the report of the National Maternity Review, and it really sets out the vision for maternity services when it was written for the next 5 years. So it's currently the piece of policy that we are working to within maternity services, and it's really essential reading to have an idea of the priorities for maternity care at this moment in time. So what skills do you need to become a midwife? Well, it's a highly skilled job. Listening and communication, there's a reason that this is top of the list. Really, listening and communication plays a part across all aspects of the job. It's a really crucial skill to have, not just listening and communicating with women and their families, but also with your midwifery colleagues, the wider maternity team, and other agencies. And speaking of teamwork, it's all about teamwork, partnership with that woman and the wider team. And so to be able to communicate well and operate effectively within a team is crucial. Attention to detail and problem solving are two really important skills to have within midwifery. There's a huge amount of complex information to process and share, and also to try and make sense of in order to plan care for women, to advise women, and to inform them about their choices. So it's really important that midwives are able to process all of that technical information and communicate with women on different levels. And compassion is hugely important. Midwifery and the period of time during a woman's pregnancy and postnatally is a really challenging, highly emotive, and sometimes difficult time. It's also a sensitive point in people's lives, as well as being hugely exciting. So it's really, really important for midwives to have compassion and to be able to really use that compassion to support women at really quite a vulnerable time in their lives. And then finally, reflection. Now, reflection is a skill that you will be very familiar with very quickly after starting midwifery training, because it's something that begins from the moment you become a student midwife. And reflection is the ability to think about a situation that you've been in and to understand how events unfolded, what your position was within that, what the position was of the people around you, and to understand how to learn from those situations. Within midwifery, we're constantly learning, and a big part of that is reflection and being able to understand what's happened, learn from it, and improve things. So, becoming a registered midwife. So this picture just gives you an idea of the route that you can take through to your midwifery qualification. And this tells you quite a traditional route, and it may be that in the case studies that you've seen, you've actually heard about some different routes to get into midwifery. But this is about starting with your GCSEs and A-levels or equivalent, and then moving on into full-time study. And studying to be a midwife is usually a full-time course. The only exception to that recently is that we have had the introduction of midwifery apprentices. And that's a situation where people actually train on the job. So there's a split between working clinically and studying. Once you've completed your course of study, you become a registered midwife. You work and you gain experience, and then you're able to think about future career pathways. And these four items at the bottom, so where it says clinical, education, research, and leadership, these are what are called the 4 pillars of advanced practice. And so that's when you really have become a senior midwife and you're thinking about how you want your career to progress. And often that progression will be focused on one or more of those aspects. So you're thinking about being a midwife, but what are the best parts of the job? Well, again, you'll have heard from some of the case studies you've already seen about why midwives at the Norfolk and Norwich love being midwives there. And there are lots of reasons that being a midwife is a fantastic job. Not least because it's constantly varied and changing. You're always meeting different people of all ages and backgrounds, and like I said before, constantly learning all the time. Your patients will inspire you because you meet amazing women and their families, and the stories that you hear and the contact that you have with your patients is really what makes you love the job. It's that inspiration that you gain from people you see even in the completely ordinary situations, making that transition through to being a parent is inspirational. You're able to make a difference to people's lives every day because a huge part of midwifery care is about promoting health and advocating for women and their families. So in that professional friend role, you're thinking about the whole woman, everything that might make a difference to her life and her health, and how you might be able to influence that or advise her in her pregnancy, and also to advocate for her, so to help to speak for her when she perhaps needs some support to do that. And patients put massive trust in you as a midwife, and as midwives we're responsible for living up to the trust that is put in us. We know that there's a national shortage of midwives, so you wouldn't ever need to worry about being out of work. Sometimes with other degrees you can finish your degree and find that there isn't a job to go to. At the moment in midwifery there is a shortage, so that's a good thing if you're keen to have a secure outcome at the end of your degree. The other thing about midwifery is that you can change your career path if you want to. So training to be a midwife gives you choices. Like I mentioned earlier about the 4 pillars of advanced practice, you could take a position in research or teaching or go into a leadership role. You're always able to change your career path if you want to because of the skills that you gain through midwifery, which can be applied in other situations as well. Now, of course, there are all the great things about being a midwife, but naturally there are challenging parts to the job as well. So they are long working hours. Mostly we do 12-hour shifts, and that's usually 12 hours on the go, on your feet all the time. So you need to be prepared to be really active. You need to be able to respond to the fact that the work is in challenging environments. There's lots of pressure, difficult situations which can change very quickly, and you need to be able to respond to that. And also situations which can be emotive and sometimes can be quite hard to deal with on a personal level, as well as caring for the women that you're caring for. So it's definitely challenging. One of the hardest things is coping with the death or ill health of a woman or baby. Fortunately, this is rare, but it is, however, a part of the job which is important to be able to know that you are able to cope with, but also to know that within midwifery there is support to enable you to cope with those situations when they occur. And it can be difficult to separate your home life from your work life because it's such a demanding job. Sometimes it's hard to switch off at the end of the shift. And as a midwife, part of your ongoing professional development is learning how to manage that separation and how to keep your psychological well-being healthy. And a really important part of that is supervision within midwifery. And we have midwives known as professional midwifery advocates, and part of their job is to help care for you and to make sure that you have supervision that you need and support to be able to manage the challenges of being a midwife. So, how do you get into being a student midwife? Well, there are a couple of options. So there's 3-year training, which is known as direct entry. Sometimes it will be 4 years training with a master's pathway attached, so you can qualify with a master's at the end of it. If you're already a nurse, then you can undertake post-registration training, which is an 18-month programme. As I mentioned earlier, we now have midwifery apprentices who are training on the job. And if you want to find out more about education in midwifery, you can look on the NNC, so that's the Nursing and Midwifery Council Standards Framework for Nursing and Midwifery Education. And that just gives you an idea of the requirements that there are from higher education institutions on how they deliver programs of education. So you've done your training and are now a newly qualified midwife. What would you expect as a newly qualified midwife? So most newly qualified midwives are offered a preceptorship programme, And that's usually a program that lasts around a year, and it's a structured way of starting your professional life. So within that year, you're able to access additional support. You have a focus on developing new skills, which perhaps you didn't develop as a student. And it's a chance to be integrated into your new team, but your new team perhaps where you've worked as a student midwife, but into that team as a qualified midwife. And it's really the beginning of translating that knowledge into practice. So where you're working under your own registration with responsibility for the women that you look after as an independent person rather than as a student. And those skills continue to develop throughout your preceptorship time, and a big part of your preceptorship is reflecting on the skills that you need to develop, so using those skills of reflection. And as part of that, you develop a portfolio, and the portfolio is something that stays with you throughout your whole midwifery career, and is really a record of your ongoing learning, continuous professional development throughout your career. Your salary as a Precept D midwife is at band 5, and usually on completion of your preceptorship, you then progress up to being a band 6 midwife. There are also opportunities abroad once you have qualified and gained some experience. And certainly from the Norfolk and Norwich, we've had midwives over the years go and work in all sorts of different places, including closer to home, Spain and Italy, but also Australia, New Zealand, South Africa, Oman, Dubai. So there are opportunities to travel all over the world really with your qualification. So as a midwife, you've finished your preceptorship year, so then really it's about gaining experience. And sometimes it's at this point that you start to think about the area that you might most enjoy working in. Usually our midwives are employed on rotational contracts, which means that all midwives get experience of working in all areas of maternity, and we rotate regularly through those areas, which is a really brilliant way of understanding the whole picture of the maternity experience. Over time, you might find that there's one particular area that you have particular skills in and that you want to focus on, but the value of gaining experience across the service is a really crucial one at first. And over time, you might gain extra responsibilities, for example, running the ward, taking part in audit, investigating clinical incidents. You might become a preceptor yourself, so you might have a midwife looking to you within that role, so looking after a newly qualified midwife. You will also work with students yourself, and they will start to gain knowledge from you. And then moving into a more senior role, so that might be within ward management or within more of a specialism. Okay, so just to say hello again. So we have had a little bit of a look around becoming a midwife and the kinds of skills that you need and knowledge that you need, and we're now going to have a little bit of a whistle-stop tour of midwifery at the Norfolk and Norwich. So this is going to be looking at each of the different areas of midwifery and meeting some of the midwives who work in those areas. So we're going to start with community midwifery, and then we'll look at antenatal clinic, Cly antenatal ward, the midwife-led birthing unit, delivery suite, and Blakeney postnatal ward. So these different areas are the main clinical areas of our maternity team, and across the midwives work across all of these areas. So starting with community midwifery, this is Frances. So Frances said, being a midwife means you're part of women's lives when they're at their most vulnerable, and you can be the one to make a difference. And this really, for me, sums up the unique, special nature of the job. It's a really incredibly special time, the pregnancy and postnatal period. And really, as a midwife, you are in a very special position, being able to support women and their families at that time. And that's why it's such a rewarding job. As a community midwife, you can be the main carer for the woman throughout the entire pregnancy and during birth and postnatally. It's possible that if a woman opted to have a home birth, that she would just be looked after by community midwives throughout her pregnancy and postnatal experience. So in that way, you can be completely autonomous as a midwife. So you are an autonomous practitioner, which means that you practice without needing to get input from anybody else, provided that everything is low risk and straightforward. You also run your own antenatal clinics and postnatal clinics. You can do home visits, which tend to be more postnatally, but also sometimes antenatally. You work very closely with others in the community. So for example, the health visitor. And you also have a responsibility for safeguarding processes, so making sure that women and their babies are safe throughout the whole pregnancy and parenting experience. Being a midwife in the community can be exceptionally rewarding because of the relationships that you build up with the women that you care for. You tend to have that relationship over a longer period of time than with any other midwife that looks after that woman. So it's really rewarding to be able to build up that relationship and see how her life changes and how things grow over that time. So moving on to antenatal clinic. So antenatal clinic is the place that you come where you have scans, or if you need to see any of the medical team for any of your antenatal care. So usually women will have ultrasound scans at their dating, so for their initial scan when they're usually around 12 weeks, and also at a 20-week scan, which is called a fetal anomaly scan. So that's when the sonographer looks really closely at the baby and makes sure that the baby is developing well. If you have any medical complications at all, then you might be under consultant-led care. And that means that as well as going for your scans, you will meet somebody from the consultant team within the antenatal clinic. And then if you need any additional planning within your care, that's where that would happen. So you might have additional appointments if something is complicated in your pregnancy. And because of that, we have specific clinics within antenatal clinics. So for example, we have a diabetes clinic, we have a clinic for women with vulnerabilities, we have a clinic for fetal medicine, and numerous other clinics specifically for women with particular needs and with medical expertise to do with those needs in the clinic. So, Cly Ward is our antenatal ward. So, antenatal is everything during pregnancy. And we're going to meet Amy now, and Amy is a midwife on Cly Antenatal Ward. She says that she really enjoys working on the antenatal ward, but she does talk about the complexity of the role. And some of the things that she mentions, like delivering compassionate, high quality, safe, effective, evidence-based care, just give you an idea of how complex this role is and how many different things you're trying to balance. It's really crucial that the care that we give is evidence-based. So as a midwife, you need to understand why it is that you're doing something that you're doing. So why it is that a particular treatment is happening, or the way that a pregnancy might be managed. And the ward can be extremely stressful and busy to work in. And so you have to really be able to prioritise and manage your workload effectively. This comes back to that skill again about attention to detail. So Amy says about women often having complex medical or obstetric histories when they come onto the ward. So it's really understanding all those different layers of complexity to somebody's case so that you can communicate with the woman about that and with the wider team, and also make sure that the care is planned effectively and nothing's missed. The last thing that Amy says is interesting. So as midwives, we're trained to be the experts of normal pregnancy and birth, but to recognise any deviations from normal. To provide these women with normal midwifery care, care that they're entitled to and deserve alongside their medical care, is a real privilege. And it's so true, midwives are the experts of normality, But a key skill that we have is recognising when things are deviating from the normal path of events and getting the right input if it's needed at that time. And Amy talking about providing that normal midwifery care alongside their medical care feels like a real privilege to her. And I think the word privilege is one that you will have heard people use a lot when they're referring to their lives as midwives, because it is a real privilege. So MLBU stands for the Midwife-Led Birthing Unit. And now these pictures will look a little bit different from the ones I'm going to show you in a minute of delivery suite. You'll notice that the rooms are set up with low lighting, with birthing pools, mattresses, balls on the floor. And that's because the midwife-led birthing unit is designed to be a low-risk birth environment where women are encouraged to be mobile and active in labour. Quite often they will birth in the water. And it's, as it says, midwife-led. So earlier on I mentioned about midwives' autonomy. So this is somewhere where someone might come in from the community to give birth and will just have a midwife looking after her throughout her pregnancy and delivering the baby. And there'll be no medical input at all as long as everything remains normal. So it's a very special place, the midwife-led unit. And our midwife, Vicky, who works on the midwife-led unit, says that the best thing about being a midwife there is that autonomous working, which means you can facilitate women to have their dream birth and start motherhood feeling amazing. And that is, again, the privilege and the joy of being a midwife, is being able to be in that position where you've helped someone make that journey. So moving on to delivery suite. So delivery suite is an obstetric-led unit, and so that means that the main care within that unit has an obstetric focus. So midwives still look after the women giving birth, but it's alongside the team of obstetric doctors who also have input into the labour and the planning. So this would be anybody who was not low risk for their labour and birth. And this is where you maybe would have an assisted birth if there was a reason that an assisted birth, so such as a forceps birth, needed to happen, or a caesarean section. It's also the place where there are different options regarding pain relief. So if you want to have an epidural, then women will go to delivery suite. So it's a different setup. It's bigger than the midwife-led unit, but they still do have a birthing pool on the delivery suite. So a water birth is still possible there, but it's a slightly different environment than the midwife-led unit. And it's really important that it gives an excellent level of care to women with a slightly more complicated labour or expectation from their labour. And Melissa is one of our midwives on delivery suite. And she talks about how it feels when things don't go according to plan and how it can be a real challenge to support women when difficult things happen. And as a midwife, you need to be able to offer that support even when things get tough. And that can be a real challenge to manage supporting that woman as well as managing your own feelings about what might be happening. But the joy of welcoming a new life into the world is the same regardless. And Melissa's another midwife who talks about the privilege of just being there with a woman and her partner at that joyful time. So Blakeney Ward is our postnatal ward. So this is the ward where women go after they've given birth, and it's a ward where we can accommodate up to 32 mums and their babies, and will often be the place that people go if they've had, well, will be the place that people go if they've had a caesarean section, or if there's any other recovery from their birth that is needed, if there are any extra observations, if they have any need for feeding support, or if they're closer, just keeping a closer eye on baby sometimes, they will all be staying on the postnatal ward. And Kylie is our Blakeney midwife, and she enjoys, as a midwife on the postnatal ward, being able to take the time to listen and provide support and reassurance because of that recognition about that transition to being a parent and how up and down that can be, and how supporting women to be part of that journey is a really important thing to do. So you've met all of our midwives you've met midwives from each of the different clinical areas. We then also at the Norfolk and Norwich have a number of different specialist midwives. So you might be surprised to know about the different range of specialisms that there are in midwifery at the Norfolk and Norwich. So we have bereavement, diabetes. Skylark team is the team that looks after women with vulnerabilities such as mental health or substance misuse. We have digital midwives, antenatal screening midwives, midwife sonographers, practice development midwives, research midwives. So a huge number of different specialist roles that you can go into further along the line. So I'm just going to talk through a couple of these examples. So this is Carrie, who is our specialist bereavement midwife, and she supports families who are experiencing baby loss. And the bereavement midwife role exists because of the hospital's commitment to the National Bereavement Care Pathway, which is all about improving the quality of bereavement care. So this is what Carrie works tirelessly to do to improve the experience of women and their families who've experienced baby loss. Nina is a diabetes specialist midwife, and with her colleague Lou, they support women with diabetes, giving them advice about diet, medication, psychological support, all as part of the wider diabetes team. And part of their job is having a really great relationship with the women who have diabetes and rely on them heavily for support during their pregnancies. We have digital midwives. So the digital midwives are really leading the way in which technology is used to enhance the care that's given in maternity and improve outcomes. So it's a really important job, which is at the forefront really of all of the changes that are happening within technology, and there are lots of them at the moment. So for example, they are working on a new patient portal which gives women access to their own patient information, and that's something that will change hugely and is a big move away from the way that we've worked historically. So it's a huge amount of change that goes on in digital work, and it's a really crucial job to understand midwifery and understand pathways through pregnancy and postnatally, but have that focus on the digital understanding of what can add to that and enhance it. We also have antenatal screening midwives who oversee all the screening programs for maternity. They do things like making sure that screening tests don't get missed, support and train colleagues, they counsel women about results. It's a hugely important job, and one in which you have to be extremely careful that nothing gets missed. The conditions that we screen for in pregnancy and postnatally are life-changing, and we have to get it right. And so it's really crucial within that job that there is proper oversight of how all of our screening operations run and the results, and communicating those results. Gemma and Chloe are our midwife sonographers, so they have highly specialist skills in sonography and independently carry out ultrasound for women on various different care pathways. So for example, if women smoke a significant amount of cigarettes, there are risks of the baby not growing well, and so they would be on a smoking pathway, so that means that they would have additional scans. And Gemma and Chloe would be the people that carried out those scans. So again, they have a really ideal opportunity to combine all of their midwifery knowledge along with their specialist sonography skills, which provides a really good service to women on one of those pathways. So finally, just to talk a little bit about my journey. So as somebody thinking about going into midwifery, I really liked the idea of doing a job where I was supporting women. I honestly thought I was too squeamish to be able to do it because I really didn't like the sight of blood, and so I thought that there was every chance I would start and then not be able to carry on doing it. But actually that turned out not to be an issue at all in the end. And I think that really over my midwifery career, I've worked across all different areas of the hospital unit and also in community. I've also held roles as a research midwife. I'm now a specialist midwife within the Skylark team. So that's enabled me to really focus on perinatal mental health, which is a particular passion of mine. I'm also doing a doctorate part-time, so I've been able to combine clinical work alongside academic work. And I can honestly say that in 15 years since I started training, I have never been bored, and in fact new opportunities come up all the time, and it's possible to make opportunities by being creative and looking around you. So it's constantly interesting, and I think if you want a really interesting, challenging career in a constantly evolving workplace where you feel privileged to be, then absolutely midwifery is that career. I cannot recommend it enough. So thank you so much for listening to this webinar, and I hope you enjoy this alongside all of the other virtual activities that have been provided during Midwifery Week. And all I can say is you will not regret making the decision to become a midwife if that's what you choose to do, and good luck with that path. Thank you.